Hi, good afternoon. I want to welcome all of you to the Autism Society San Diego's current topic is an autism lecture series. And today we're really fortunate to have a couple of people who work at Rady's Children's Hospital here in San Diego talking to us today about a really important topic, which is how to make the healthcare experience more autism friendly and strategies and things that we can all do to help our loved ones have better experiences with healthcare providers. I am going to turn it over to our two speakers now. We have Abbey and Elizabeth, and each of them will introduce themselves. So thanks for joining us.
Awesome. Thanks so much. And thanks for being here, everyone. My name's Abbey. I am one of the BCBAs on our autism friendly team. And I also have Elizabeth Gallagher with me, who is also on our autism friendly team. We both work part of our time in the Rady's Autism Clinic and then also run our Autism Friendly initiative, which you'll learn more about today. Next slide, please. I can't control it up here, right? Okay. Okay, so today we're going to go over some of the barriers to accessing healthcare our neurodivergent youth face. I'll talk a little bit about the national momentum around the country, and then really what are we doing here at Rady's to improve healthcare for this population, and then how you as families and self-advocates can really collaborate and work with your healthcare providers to improve the care experience. So what do we know from the literature? Right now, as many of you are probably familiar with, our autistic youth, they have more complex medical needs, right? So GI disorders, seizure disorders, sleep disorders, and also they are more commonly have co-occurring mental health diagnoses. They are using the healthcare system quite differently than their typically developing peers. So they use emergency care services more frequently. They are, when they do get into the ED, they're more likely to be hospitalized and their stays are longer. They're less likely to use some of their standard outpatient care. When they are in the hospital, they are at risk for inadequate pain control. They are more likely to need extra staff to support during procedures like an IV. They're more likely to experience restraint. So overall, their experience is much more stressful and they're not always getting that medical care that they need. We know that even though they're utilizing that healthcare system a lot more, they actually have poorer health outcomes, reduced life expectancy, and they and their caregivers report that they are less satisfied with their care. There's a good study done on autistic adults, and they reported just that a lot of frustrations around just making appointments and being able to adequately communicate with their healthcare providers. In terms of providers, they also report that more stress, less confidence in caring for this population. They don't get adequate training in caring for autistic youth and adults. So that's just what we know from the literature. That's also what we experience at Rady's. Next slide, thanks. Then kind of on top of that, many of the tendencies that are inherent in autism diagnosis just make going to the doctor or going to the hospital more stressful, and they experience a lot more barriers. So we know autistic individuals have social communication differences. So the healthcare setting really relies on verbal communication, right? But if you're more likely to communicate with pictures or through sign language, that's already a barrier from the get-go. Visits are usually 10 to 15 minutes long. And so if you need more processing time, the healthcare system is just not set up for that. Then if you maybe have more challenges just communicating your basic needs, whether it is that you have pain, you're hungry, you're thirsty, you need a break. In the context of a medical setting, that's added stress, right? If you're not yet able to communicate those things. We know that autistic individuals just also have a strong preference for sameness and routine, right? We all like to know what's expected in our day, what's going to happen. But for our neurodivergent youth, this is that preference is much stronger and much more pronounced. And going to the hospital, going to a doctor's office, this is out of routine. This is not something that happens every day. So that's an added stress. Our neurodivergent youth also experience sensitivity to different stimuli, and every individual is different and how this presents. But the hospital's full of noxious stimuli, right? Like this could be a page being called overhead. This could be the fluorescent lights buzzing. Maybe it's just the touch that's involved in vitals or during an exam. There's all sorts of stimuli that is not common and that they are not used to seeing. That can be overwhelming. Even just the waiting room, right? It's busy. There's a lot of people in there. Babies are crying, all sorts of stimuli coming at them. And then they tend to have more challenges at baseline with coping and self-regulation. So you put them in a setting where there's a lot of external stimuli, maybe communication is more challenging. You're just kind of setting up this like recipe for kind of maybe a meltdown to happen in this setting. So that's just kind of how we're coming into the situation. What is really nice to see is there is a lot of national momentum in terms of recognizing that we need to adapt care. So a lot of people are recognizing it. We're in that phase of like, but how do we actually adapt care? That is the process that we're all trying to figure out. There was a really nice publication out of Boston where they got a group of providers, parents, self-advocates, caregivers together, and they put out a consensus statement. And part of that consensus statement was this NDD Healthcare Bill of Rights, which you'll see on the screen. And I think this is really critical and just really reinforces everything that we've been doing as a part of our initiative. So individuals with NDD have the right to consent and assent to participate in their healthcare decision making. They have the right to have access to care that's proactively adapted to meet their needs, to make sure that they have their preferred mode of communication, and for that to be for their healthcare to be free of restraint, to make sure that they're receiving adequate pain and anxiety management. So really great to see all that, but now it's how do we put that into action? So here at Rady's, we have developed a kind of mission, vision, and core values that really define our program. And our mission is to really improve the healthcare experience for these autistic patients through staff education, patient and family self-advocacy tools, and then adapting that patient care. And our values are to provide that patient-centered care. So really taking that time to get to know that patient in front of you and their family and what do they need, what is going to make them most comfortable, how can we adapt the care specifically for them. So we're really working on collaborating with not only the patients and the caregivers, but also the healthcare providers, right, to make those adaptations. And we want to empower families and patients with these tools so that they can also advocate for that medical care and empower providers that they feel more comfortable caring for that population. And we'll talk about all the strategies that go into that today, but we are also looking at outcomes to us. You know, if we adapt care in this way, or if we use this particular strategy, is that meaningful? Is that actually changing or moving the needle on how this child or this young adult received care? Awesome. So these are our kind of 5 core components about. So when we're training staff within the medical system, we are really focusing on first teaching them about our autism friendly questionnaire, which we'll get into more details in a little bit. But this is a a patient and parent entered questionnaire. So the family and the patient are able to tell us what works for them, what does not work for them. We then, in the staff training, teach the staff how do you take that information and use these proactive behavioral strategies to adapt the care. And then we also provide them with a toolkit because sometimes they're going to need some visuals or some sensory tools to actually make those adaptations. When we're doing staff training, we're coming into the department and we're really learning like what is not working in this department for serving these kids, what is working, and we're really adapting based on like the common procedures that they're doing. That's how we're developing that training. So every department gets a different training. We are also providing at Rady some consultation and embedded services. So myself and Elizabeth are the BCBAs who a few days a week, we are in the emergency department in our inpatient psych unit. and then different places in the hospital when we get a call for a higher need patient. But we can't be there 24 hours a day. We are a small team of two. So that's also why we're training the staff, right? They have to be able to do this when we're not there. And then again, like I talked about earlier, that program evaluation piece where we really are looking at staff outcomes and patient outcomes to evaluate the effectiveness of the initiative. But for today, since we know the majority of the audience is going to be caregivers or parents, we're focusing on our questionnaire. If you're not at Rady's, what can you do? If the hospital or doctor office that you're going to doesn't have a similar questionnaire, some of the strategies that might be helpful and kind of how to utilize things you already have to make your own kind of toolkit. So we'll start off with the autism-friendly questionnaire. So you'll see on this screen, it is a brief 10-question questionnaire. And this was developed by a multidisciplinary team. So this included nurses, physicians, speech therapists, occupational therapists, psychologists, but also caregivers and self-advocates. So really to develop and kind of hone in on what is the important information for a provider to know about your child or your young adult. So how do they like to communicate? What is the best way for the medical staff to communicate with them? What are things that might make them nervous or upset? And when we're training staff, we're trying to make sure they're really honing in on like what are common triggers and can we adapt or remove any of those? What are things that we know, or what are some signs that your child or adult is getting a little bit nervous? And that's kind of a clue to us as providers, hey, we need to slow down. We need to take a beat and kind of reassess. And then what are some helpful techniques that are going to help your child? Is it modeling? Is it making sure they have their noise canceling headphones? Is it making sure we have a picture schedule so they know what's going to happen in the visit? Is it making sure we're giving them choices at every step of the way? Any behaviors you would want a medical team to know about, and then a really important one, how do they demonstrate pain? So this, we know that our neurodivergent youth may have really high pain tolerance to certain input or really low pain tolerance to other input. So again, this is very patient specific. And then the last couple of questions are really looking at what does your child like? What motivates them? What are good things that they really like to talk about? Their preferred interests, because that can be used as distraction tools or as regulation tools throughout the visit. And then this goes in to their medical record. So even though on the previous slide, we were showing you a paper version. So if you're going somewhere outside of Rady, we'll show you how to print. You could print that off and just hand it to the providers when you go to any medical visit. Doesn't matter if they're Rady or not. But if they are at Rady's and you do that as part of your visit, that is in their electronic health record. So the nurses, the physicians, the medical assistants can review that really quickly, just in electronic format. If you animate the slide for me, it'll show the other one. Sorry about that. Oh, yeah.
No, you can just slow down on
it. Okay. I'm a fast talker. Thank you. That's good feedback. Okay, so this is the questionnaire in a couple of different translations. So we have a teen version. So if your autistic child does not know about their diagnosis, but you still want them to maybe fill out that questionnaire, you can call it a coping questionnaire and give it to them that way. We also have a visual and picture version. So we know many individuals who want to fill out their own questionnaire. Maybe they process language better when it's depicted pictorially, and so we have a picture version, and so that they can answer their own questions. So it's the exact same questionnaire, but using pictures. We do have it translated in Spanish, and we're in the process of getting it translated into the top 10 languages that are requested at Rady's. So that's in the works, but we can always use our interpreter services in the hospital setting if your primary language is not English or Spanish and you would like it to still receive that questionnaire. Awesome. So that is the questionnaire. I think the biggest thing to stress with the questionnaire is, again, yes, we have it built within Rady's, but you can take this wherever you go and ask that it's put into your child or adult's medical record. There's nothing on the questionnaire that is child specific. So if you have a young adult and you would like that as part of and maybe they get their primary care at UCSD or at SHRP in the adult setting, there's no reason that can't be scanned into their medical record or placed in their chart. Sometimes I have families who will keep just a picture of it on their phone or a physical copy of it in their kind of in their hospital go bag, and they just hand it to the provider when they go in. So it's just it's a tool for you to be able to advocate for what they need. There's a lot of other hospitals doing this around the country. People call it different things. Some people call it an adaptive care plan. Some people call it a My Health Passport. So if you're Googling and researching about it, there's a couple different versions out there. Okay, so we will talk next about some of the strategies that we train staff on, and these are the same strategies we would recommend as a caregiver or parent to use. We're gonna be adapting them slightly differently just because you are the caregiver instead of the provider. But we kind of prescribe to these 5 core strategies, and these are all based in evidence-based behavioral strategies, right? We didn't make these up. There's a long history of the efficacy of these strategies. So slowing down, adjusting your communication, we'll just jump right into them. No, you're fine. You're fine. So the first one is slowing down. So again, when we're training providers, we are just urging them to take that extra time to make that plan proactively and look at the questionnaire and figure out, okay, how does the child in front of me communicate? What adaptations do I need to do? But as a caregiver, again, your role in slowing down is really getting that questionnaire completed, or if you already have it completed, handing it to the provider if you're not at a Rady's facility, and just educating your team on what your child needs. I would say the majority of providers are very open to this. They just don't know, how do I use pictures to help with the vitals, etc. When you are making the appointment, just thinking about the time of the appointment. So if your child has trouble waiting or just has trouble with busy, loud waiting rooms, if it is a scheduled appointment, can you make it for the first appointment of the day or the first appointment after lunch so that the waiting room is not as busy? Also, when you're calling and making that appointment, you might ask the provider, what's going to happen in this visit so that you're able to prep your child about what the steps are. Are they getting a vaccine? Is it just kind of a general child checkup? So then again, you have the tools then to prep your child. If when you get there, the waiting room is really overwhelming, or your child just tends to have a harder time waiting, you can advocate for waiting in the car and having them call you when it's time, when a room's available, or waiting outside. And then again, I know as autism parents, you are constantly advocating for your child, and I hate to have to tell you to do it again, but I just think at every step of the way, advocating for those accommodations. So maybe they have difficulties with transition, saying, a lot of times in primary care, they'll do the vitals in one room and then we'll walk to another room, just letting them know hey, my son has trouble with transitions, let's do the vitals in the room where the provider is going to do the exam. Maybe injection can be done, asking can we do the injection in the car if they tend to have trouble in the actual provider room. And then you can also advocate for provider and room consistency. So thinking back to that, one of those first slides where we talked about routine is really important for this population. So if they can have the same provider in the same room every time they go to the doctor, that's going to make their visit easier. Perfect. Okay, so the next piece is adjusting your communication. So as caregivers, you know your child best. You know exactly what they mean when they're trying to communicate with you. The providers don't. And so you're always translating for them, but we want to maybe use some different tools in the medical setting. So if they use alternative modes of communication, bring those to the medical visit with you. I know it's hard with an ED visit is out of the blue. You don't know that is happening. But some families will just always keep this very basic communication board, in their car or in their purse, in their hospital bag, just so it's always there in case. But if it is a scheduled visit, bring those communication tools with you. We know that we are more likely to see interfering behaviors if the individual can't communicate their basic needs. When you're preparing your child, explain the steps and the sensory experience in a way that your child is accustomed to. So if it helps them to prepare and walk through like the different steps of a vaccine or the different steps of like what a blood pressure is going to feel like, making sure you're communicating that to them in a way like using the language that they're accustomed to. So you're going like if they're normally using 3 to 4 word phrases, you're explaining it using 3 to 4 word phrases. And then we really stress being honest with them about what's going to happen. Telling them there's not going to be any ouchies or it's not going to be hurt, nothing's going to hurt, and it's not, there's nothing to worry about, usually backfires because then when they do get a vaccine or something is painful or they perceive it as painful, now we've lost that trust in the medical system, right? We told them this wasn't going to happen and now it does. So next time they go there, they're more likely to engage in avoidance behaviors because we didn't know what to expect. So it's normal for like to tell them that and they still get upset. That's okay. And you know your child best, like some kids might need prep 3 days in advance. Another kid is going to do much better with it like 30 seconds in advance. That lessens the amount of time that they have to get anxious about it. Giving choices. So again, in a medical setting where a child feels like they don't have a lot of control and autonomy, trying to make everything a choice. You know, do you want to sit on the table or on the chair? Do you want them to do your blood pressure first or your temperature first? Wherever we can embed choice, that can be really helpful. Using that first then language, as long as there's something that they're motivated to get. So first we're going to talk to the doctor, then you can play on mom's phone. That then always needs to be something that they want or it won't work. And then if your child's engaging in any type of behavior that's interfering with the exam or interfering with the procedure, trying to redirect them to what they can do. So a lot of times our gut is to say, no, stop, you have to sit down, etc. But instead, like let's say the doctor's trying to listen to their lungs, and they're kind of pulling at the stethoscope. Instead of saying no or stop, we're putting a squishy ball in their hand and saying your job is to squeeze the ball 5 times. The doctor is listening. So you're giving them a job and a way to regulate and telling them what they can do. Okay, the next piece is preparing the patient. So kind of extrapolating on what we already talked in the previous one, but if it is a scheduled visit, and again, you know your child and you know it's helpful for them to have that repetitive practice, practice at home. If you know this is, again, thinking back to like the slow down is find out what's going to happen in that appointment. And then we're also going to infuse adapting how they like to communicate. So if they do well with pictures or they do well with you modeling it, that's how you're going to practice it at home. Many autistic individuals benefit from that repeated practice, especially in a low stress environment before they get to the doctor office. They also recognize like you are busy families, you have other things to do. Like if they're getting other therapies, ask the therapist to incorporate that into their therapy. Again, that only works if this is like a scheduled visit in advance. But their ABA therapist, their speech therapist, their OT, they can all be working on these things for you, even school. And then there's lots of different ways that we can prepare. So we can use pictures if they prefer that. We can write things down. Some kids do well, where adults do well with it, just like the steps written out of what to expect. Medical play, so using the actual tools to show them, like on a stuffed animal, on a doll, even on yourself, like that engages them in that power play. Like they get to be in charge and do the steps on you. And then social stories, which we'll get to a little bit later. And the toolkit really, instead of it's a little bit more lengthy than just like the picture schedules. It's going to go into more details in a story format of what to expect during a visit or during a procedure. And then also providing that structure and schedules, not only if they're just admitted, but even just a general, maybe specialist or outpatient visit. If you could do this, some kids benefit from like, oh, I just need the pictures for like this specific procedure. Other kids will need the schedule for the whole visit. This is exactly what we're going to park the car. Then we're going to check in at the front desk. Then the MA is going to do my vitals. Then I'm going to talk to the doctor. Then we'll go home. So again, that schedule helps to decrease anxiety, increase understanding, more likely to engage in their medical visits. And then if you are ever admitted in the ED or you're in the hospital setting, if you're in a pediatric setting, you can advocate for child life. Or if you're at Rady's, you can advocate for seeing one of the BCBAs. We can also help facilitate that prep for certain procedures. Okay, this is just an example of, we just did a training at all the primary care offices for CPCMG, and these are toolkits that we made for providers to give to families when an individual is having a harder time with maybe blood pressure or injections. Those are kind of the two things that commonly happen during the primary care visits. And these are, again, are for kids who are having a really hard time with this, and there's nothing we could have done in that like setting in that one visit to change this, but they're going to need that repeated practice at home, probably with their other therapist, to desensitize and to be able to come in next time feeling a little bit better about this. And so we have a tip sheet, and then we have a QR code with all the social stories, and then we actually will send home the blood pressure cuff and a syringe, obviously without the needle, so that they, and the alcohol swab, so they can actually practice this at home. So this will be on our website, and we'll show you how to get all of that information. But just, again, we're thinking back to those care trends, and when a lot of autistic individuals are engaged in a lot of healthcare avoidance, and this starts at a young age, but then as they get bigger, it's harder to get them in the door, right? And we want to kind of intervene before that, so that they don't have worse health outcomes than their typically developing peers. So different ways to do that. But this is just one example of that. Okay, the next strategy is accommodating sensory differences. So again, you are your child's best advocate for this. Every child is unique. We know that. The medical staff are going to need to know what is aversive to your child. And so just, again, part of like the parent role, and this is just reminding them like, hey, they really, they don't like touch. So can we like wait for the exam till the end? So then like the exam is done and then we immediately go. If you know that they really benefit from having like noise canceling headphones or sunglasses or having those fidget toys, making sure you're bringing those with you. Whenever you get into a room, if you look at this and you as a parent are like, oh, this is not going to work, like let the medical provider know, like, hey, we need to like move the vitals machine out of here. We need to like go into a room where the cupboard's actually locked, like figure out what can be modified in the environment and advocate for that. If they need to wait outside until like the last minute, setting that up. And then there's also when they have to have any type of procedure that is painful, you can advocate for alternative positioning, right? So there, we know that kids, and Elizabeth's going to talk about this a little bit later, feel more threatened when they're like forced to lay down. And so there's different ways to engage in comfort positioning, even for adults, that can make them feel kind of like more in control and less fearful. And then maybe it's that the doctor is prescribing a medication and you're like, well, he has a lot of like oral aversions, like that's just not going to work. Ask what other ways the medication can be administered. There's all different things that we can do there that hopefully will help them be able to take their medication. And then the last strategy is those rewards, the distraction, the coping. So if your child really benefits from a reinforcer type system to get through something non-preferred, maybe have your child pick that ahead of time, bring it with you so that they can get it immediately. Use that if that's a strategy you're used to using at home, in ABA, in school. That can be really helpful to motivate the child to engage in the healthcare that they need to do to keep their body healthy. Some kids are going to they can't wait till the very end of the procedure to get that reward. They might need little bits of it like throughout. So like you did vitals, they either get a star, maybe they get part of the reinforcement, maybe they're looking for Legos and they get like 10 Legos in the set every time they do the vitals. Okay, we've got 10 Legos. Now we're going to talk to the doctor. It's another 10 Legos, and they're throwing little bits as they go. Other kids do really well with utilizing their strong interest just to promote coping and distraction. I always use the example, we had a child, or really 17-year-old in the ED, who had a pretty big laceration that he needed stitches to get that repaired. And he was not letting anyone near him. But as soon as we did the AFQ and we learned that his strong interest was sprinkler systems and he knew everything about them, he knew how to fix any common problem that you would have. He would know which aisle in Home Depot you would need to go to get that thing that you needed to fix it. As soon as we started talking about that, and we had that distraction, again, that almost served as like an analgesic for him. He was able to let them come in and do that repair because he was able to teach the room about that. So again, the provider's not going to know that, but you as the caregiver know that, and you can kind of bridge that gap. So maybe they're getting their blood drawn, and they love, to teach everybody about the International Phonetic Alphabet. Like, you can start engaging them in that conversation while they're getting that done. Okay, let me hand it over to Elizabeth.
Thank you, Abby. Okay, I'm going to start off by talking about the third component of our initiative, which are toolkits. So before we get into how caregivers can make these for their own loved ones, we just wanted to talk about what we've done at Rady thus far. So we do have our autism carts. We have one in the emergency department, one on our inpatient psych unit, one on a medical inpatient unit, and then another one at surgical services. And these carts are donor funded, and they have a lot of different materials in them that can be used for a variety of different reasons. The top drawer that you're seeing there, that first picture, are single-use items that can be used to help a child keep their hands busy, which is lightweight, to help your child kind of cope. Sometimes we'll use them as rewards for the patients that we're seeing. So those hopefully go home with the family. Sometimes they get thrown away, but we always hope you all take them home. And then the next door there are our reusable sensory items, so noise canceling headphones, fidgets. We also have things like whiteboards in there that you can use to write out the tasks of the visit, which is very helpful. And then on the bottom, we have, again, additional sensory tools that can be reused, a light and sound machine, a weighted lap pad, and some visuals. And really the goal of the toolkits is to help us adapt the environment in this medical setting that, like Abbey has mentioned many times, comes with a lot of challenges and a lot of other stimuli. So how can we kind of modulate that sensory input for the patients to make that environment a little more acceptable? Next slide, please. And then for the departments that we train, for the outpatient departments hospital-wide, we also have toolkits that we provide to them. They have a lot of the same materials as the carts, it's just on a much smaller scale. And then, like Abby mentioned, we do customize all of our trainings for each of those departments, and they also get these custom visuals. And so all of these visual schedules go through like the most common procedures and or like steps to the visit that are going to happen in that office. So for example, like I was saying, we just trained all of the primary care CPCMG offices. And so their visuals include, like you can see here, a well child visit. They include a well child visit with a vaccine. And then some procedures they might do, we have like a urine collection sample. We have one of the splints that they can do in the office. We have like nasal swabs and things like that if they're testing for any respiratory viruses. And so those are available as well. And then we have our library of healthcare social stories. So again, these are for the departments that we've trained within the hospital. However, you can probably adapt some of them for other, healthcare systems if your child or adult that you're caring for is not getting their care within Rady. But those are all available on our website. We've also included the QR code there so you can access them. The social stories are a longer format than the typical visual schedule. I'm sure all of you are familiar with social stories, but they go through all the steps of the visit. We really like to include information about, again, the kind of sensory input they might expect, prompts to use, coping skills, and then there's also like reminders for caregivers in there at what point to use distraction items, offer rewards, things of that nature. And then at the end of each of the social stories, we also include some visual schedules for the visit as well, if that's helpful to bring along for that appointment. So this is something that you would look over before, to help your child prepare for that visit. Okay, and then Abby earlier talked about our autism friendly questionnaire at Rady. There are also some tools that are available specifically thinking about a child's transition to adult services. So yes, you could still use our autism friendly questionnaire if you feel like that is a great representation. You've already kind of completed it in the past, you feel like that's working. There are other toolkits that are available online. One that we commonly recommend is the Aspire Healthcare Toolkit. What you can see on this screen here, just kind of the different parts of the website. So they have tools for caregivers to use and self-advocates to use, for example, what to bring to a visit that a person with autism could bring so they remember all of the things. And then there's the Autism Healthcare Accommodations tool, which helps, again, provide providers that information on what's going to be helpful for the visit as far as communication, triggers, helpful strategies, all of that stuff. And then the next one, very similar, is the IDD toolkit. So this is obviously for those with intellectual disabilities as well. And there are some forms that you can complete. And again, many ways that you could share that with the team. You could message it to them. You can bring it to the appointment. You can keep a digital copy on your phone or iPad. Again, so they can kind of adapt to their own care. Okay, so now we're going to talk about how to kind of integrate all of these strategies based on what type of visit you are planning on attending. Some of this might seem really, really repetitive, but we just want everyone to feel like they kind of know how to apply all of the tools that we more generally talked about, again, in these different settings. So the first one here, we put for hospitalization, but this could be for an emergency room visit as well. Like Abbey said, the first thing that we're always going to want to do is to complete some form of the AFQ or another similar form to educate the staff on your child. Even thinking about like if it's an emergency room visit, we didn't have time to do that, like jotting a few notes in your phone if you have a moment, just so you can get the most important tips for those providers. If you are in our Rady emergency department, you can request child life. If Abbey or I happen to be there, you can also request a BCBA. And then if your loved one is at an adult care facility, you could potentially request psychology, psychiatry, and or social work can all be potential resources to support. Bring those communication tools with you. Again, you really want your child to be able to communicate their concerns and be involved in their healthcare. So making sure that those things are available. Using those visual schedules, whether that's a picture schedule or a written schedule, to increase that predictability and really help them understand the steps of the visit. Offer choices as much as possible to promote a sense of control. And this will really be you working again with the staff that are there, asking nursing like, hey, I know we have to do all of the steps of vitals. I know that, blood pressure is always really hard. Is there a way that we can give them a choice of what they would like to do first and the arm they want it to be on? Again, so they feel more in control of that situation. Advocate for pain management. So if medication is helpful, comfort positions, we'll go over exactly what those look like a little later on, and then using those distracting items as well. Utilizing rewards, again, whether that's tangibles, edibles, if you use some sort of reward system at home, carrying that over into the visit. And then again, if your hospitalizations are frequent, it's helpful to create something like a go bag that has the communication tools, the sensory supports, comfort items, and also one of those questionnaires that has information for the providers on it. Okay, and then for anyone who is having surgery, first we might want to ask if they offer a tour. Again, being able to see that environment when there's no other demands can be really helpful in preparing. You can even do multiple of those, again, just so they can kind of be aware of that environment. Practice at home, or again, like Abbey was saying, incorporate the practice into your existing ABA, speech therapy, occupational therapy. This could look like medical play if that's something that your child is interested in. Again, incorporating those preferred either characters or materials, or using one of the social stories that is available. Again, ours are Rady specific, but they could certainly be adapted to other healthcare systems. Completing the AFQ or a similar form. And then when you do that pre-op phone call, alerting the pre-op team that your child has autism, and then going over some adaptations that may be helpful for them. You also might want to talk to your loved one's primary care provider about a pre-medication, or if they already have a PRN medication for anxiety, that's something you would consider giving the morning of. Again, always checking in with the medical team for the surgery on kind of how to manage that. And then asking for first case of the day. So being NPO and not being able to eat and drink is challenging for all of us, certainly challenging for autistic individuals. And so scheduling that first case of the day can just reduce the amount of time that they don't have access to their food and preferred beverages. And then again, advocating for child life. You can also advocate for caregiver preference when they are doing the induction during sedation and then their emergence while they're waking up as well. And then day of, just remembering to bring things like comfort items, things that might help keep them distracted and busy while they're waiting or while they're recovering, and then rewards if that's something that's effective for them. Using counting and warnings, again, just to help them predict what's going to happen next, and a picture schedule as well of what's going to happen throughout that surgery day. Okay, injections and labs. Again, another thing that none of us like, but the sensory experience can be even more challenging for autistic persons. And again, like Abbey was saying, a lot of autistic people might have medical trauma that is kind of leading to avoidance of any sort of like injections, labs, needles in general. So again, completing that AFQ, incorporating that home practice. This might look a little different. So we might do that sensory play, incorporating things like syringes so they can desensitize to that. Using things like social stories, again, just so they understand the steps of the visit, especially if it's within a larger visit like a well-child visit. Describing the steps in the sensory experience. So thinking about how the tourniquet might squeeze really tight in the arm, how the alcohol wipe might feel cold and wet. And then again, just a reminder to be honest, saying something like, it's not going to hurt or no pokies today. And then we end up doing that, kind of creates that distrust in the medical system. And then identifying a reward the child can earn, bringing that to the appointment and making it immediately available after they do the hard thing of the poke. During the appointment, you can always ask for an alternative waiting space. So waiting outside, waiting in the car, waiting in the hallway. Comfort positions, again, we'll talk about that more a little later, but even thinking about alternative places for your child to sit. In the emergency department, we have really frequent success with kids either sitting in their wagons or their strollers that they've come in. That's just more of a safe space for them, and also obviously keeps their body a little more still for us. Bringing those comfort and distraction items. Providing those countdowns and warnings. And again, how do we incorporate choice into that? Giving your child or adult the choice of which arm they want to look at first. If they want, what they want as a reward, what we could use as distraction. And then using picture schedules. Again, we have these available on our website for lab draws and general like injections and vaccines. And then lastly, we have dental. So dental can be especially challenging. We're typically in that lying down, vulnerable position. There's lots of bright lights. People's hands are in your mouth. Again, no one likes this, and it's especially challenging for autistic population. So making that plan before, sharing that with the team. Dental is something that we usually have planned out for a while. So we can kind of be proactive about that. We really want to, again, practice at home. For dental specifically, we really want to think about desensitization. Even something like teeth brushing could be challenging, but working in different desensitization practices. And that would be something you might want to collaborate with the dentist office as well and see if they have any materials that you could use at home. If your child has, previous negative experiences, maybe they might have anxiety even driving past the dentist office or walking into the waiting room. Dry runs can be really helpful. So having them go to the dentist office before, just say hi to the front desk staff, maybe get a sticker or a sucker, and then just leaving for the day. And doing that a few times before the visit can also help reduce that anxiety. Asking your primary care provider about a pre-medication or giving a PRN if that's already prescribed. And then identifying again what the child can earn after that appointment, and even considering what small rewards they can earn during the appointment. During the appointment, again, bringing those comfort and distraction items. Sensory supports are especially important for the dentist office. There's a lot of loud noises, so noise canceling headphones, or just like having headphones or music on in general can be helpful. A weighted lap pad might kind of help, sitting in the chair. Again, asking for those alternative waiting spaces, countdowns and warnings. For dental in particular, if your child has a more challenging time kind of like sitting and staying still while the dentist or the hygienist is in their mouth, using something like a visual timer so they know how much time is left can be really helpful. And then again, using picture schedules to go over the steps of the visit so they really know what to expect. They're probably only going to the dentist twice per year, if even that. So yeah, not as familiar of a routine for our kiddos. Okay, and then lots of different options for pain management. So this can again go across many settings, whether this is an outpatient visit or a hospitalization. We do want to make sure that we are advocating for pain management for your loved ones. We know that negative pain experiences strongly influence future pain experiences. And can also lead to that long-term healthcare avoidance. So thinking about pre-medication, talking to your primary care provider or the surgical team, or even like the hospital team, whoever is working with you all, just about what the different options are to help your child feel comfortable and even reduce anxiety. We do have BCBAs at Rady, and these are something that are also available for parents to purchase online. We use them really frequently in the emergency department at Abbey. I do have a lot of success with them. So BCBA provides a really strong vibrating sensation, and it's proven by research to reduce pain sensations. The vibration confuses the pain signals. And we put the buzzy in between the pain and the brain is what we say. So that is a simple tool that we can use. It's very effective. You will also see our Buzzy here has these wings, and Buzzy's wings are actually an ice pack. If your child doesn't like that sensory input of the buzzing, an ice pack or a hot pack might also be something to consider. We also use Buzzy in a non-traditional way. So typically we're putting it near the poke to, again, confuse the brain. But I've had kids put it in many interesting places that they enjoy. I had a kid last week in the emergency department who wanted to put it on his feet, and it was just a nice sensory distractor for him. So Buzzy is obviously good for pokes. We might also consider it for things like wound cleaning that can be painful as well. And again, this is a tool that could be used at home or in the hospital setting. So if your child gets injections for other reasons at home, like a GLP-1, that might be helpful as well. We also have kind of topical pain control, so things like our pain spray. This is only available in the hospital setting, but something like the LMX lidocaine is available for purchase for families to use. If you're using any of these tools that are kind of over the counter, just make sure to check in with your medical provider before. Sometimes for certain like lab draws, they don't want you using the numbing creams. And then again, always going back to that distraction and strong interest and how can we kind of leverage those things and engage your loved one in things that they really enjoy during something that might be more painful to help them cope. Okay, comfort positions. I've teased this a lot. Comfort positions are a different way of physically supporting both children and adults during painful procedures. The phrase that you might hear commonly used with this is being held feels a lot different than being held down. We know that people feel really vulnerable when they're in that laying down position. And so comfort positions give alternative ways to physically support. They also involve the caregiver, which is typically a lot more calming and helps coping a lot more than a medical provider holding the patient. So as you can see here, there's pictures of all of these. Some of them might not work depending on your loved one's size. All the way on the right side of the screen there, though, you'll see head of bed. So even if your child or adult is too large to be physically held, we always encourage caregivers to be close to the head so they can provide that physical support, giving those words of encouragement. Again, you are really going to be able to help your child cope more than the medical professionals that are working with them. All right. And that concludes. We do have some time for questions. We, on the screen, really quickly, though, have a QR code to our website. Again, that's where you can find all the tools we went over today, including the autism-friendly questionnaire, the different versions we went over, those healthcare social stories, and just more general information about our initiative at Rady. We also have our email address there. If you have any questions, feel free to follow up with us. We're ready for questions. Yeah.
Good question. So thank you for joining us today for the fourth and final Current Topics in Autism lecture. And we want to wish everyone happy holidays from the Autism Society. Thank you. Thank you.